Hello everyone. Today we are studying about nephrotic syndrome. Nephrotic syndrome. So, as is shown in the name, P, P for proteinuria, P for proteinuria. So, in nephrotic syndrome, there is a proteinuria that is greater than 3.5 gram or 3 plus. And after that, there is an H for hypoalbumin, hypoalbuminemia. Anemia means decreased albumin count in the blood that is less than 3 gram. And after that, E for, after that there is a E for edema. What E for? E for edema. So what is there? Proteinuria, P for proteinuria, nephrotic syndrome, P for proteinuria greater than 3.5 gram, and hypoalbuminemia. Hypoalbuminemia means albumin is less than 3 gram. And after that, E for edema. So the characteristic sign or hallmark of the nephrotic syndrome are proteinuria, hypoalbuminemia, and edema. Hypoalbuminemia and edema. And after that, 80% of the nephrotic syndrome, 80% of the nephrotic syndrome is due to glomerulonephritis. Is due to glomerulonephritis. After that, the primary cause of the nephrotic syndromes are number one is a minimal changes, number two focal segmental glomerulosclerosis, focal segmental glomerulosclerosis. After that, third is membranous nephropathy, and number four is membranoglomerulonephropathy, membranoproliferative glomerulonephritis, glomerulonephritis. And the secondary, these are the primary. After that, secondary cause, the secondary cause of the nephrotic syndrome are SLE, systematic lupus erythematosus, diabetes mellitus. After that, we will study about some general characteristic, characteristic of nephrotic syndrome. So nephrotic syndrome, the protein urea greater than 3.5 gram per 24 hours, as we have mentioned earlier, greater than 3.5 gram, and after that hypoalbuminemia, hypo hypoalbuminemia hypoalbuminemia less than 3 gram, that edema, and hyperlipidemia. That normally the blood the blood does not clot in vessel. Normally the blood does not clot in vessel due to what? Due to anti thrombin 3. Normally the blood does not clot in the vessel due to the antithrombin 3. Antithrombin 3. But in nephrotic syndrome, the loss of antithrombin occur, which causes the chances of hypercoagulable state, which increases the chances of the chances of hypercoagulable state. Chances of the hypercoagulable state. So after that, greater the chances of hypercoagulable state, greater the chances of a hypercoagulable state when the albumin is less than 2 gram. When the albumin in blood less than 2 gram. After that, hyperkalemia where hyperkalemia occur when albumin is less than 3 gram, but hypercoagulability occur when albumin is less than 2 gram. When albumin is less than 2 gram. After that, so as the albumin is less than 2 gram, there are chances of deep vein thrombosis, DVT, and renal vein thrombosis, renal vein thrombosis, and the chances of the pulmonary embolism. Pulmonary embolism. So, what is the investigation for nephrotic syndrome? What is the investigation? What the test we are performing for nephrotic syndrome? So, first of all, we know that we will perform a CBC, that is called as complete blood count. After that, CBC, blood urea nitrogen, blood urea nitrogen, and after that creatinine. So the first test is CBC, complete blood count. After that, blood urea nitrogen. After that, creatinine. Creatinine what? This is the serum creatinine. After that, urine analysis, and 24-hour urinary examination. 24-hour urinary examination. 24-hour urinary examination. After that, the fasting lipid profile. Why the fasting lipid profile? As we have mentioned above, that in nephrotic syndrome there is what? Hyperlipidemia. That's why we are performing what? Fasting lipid profile. And after that, we will perform hepatitis C and B, HCB, hepatitis C virus antigen, and hepatitis B antigen. Hepatitis C, hepatitis B antigen, and after that SLE. So all of you were thinking about that why we are performing the tests for why we are performing the hepatitis B antigen test and hepatitis C antigen test, because some of the nephrotic syndrome are caused by the hepatitis B and hepatitis C virus, as it's in nephropathy, membranous nephropathy. And what? Membranous nephropathy, because hepatitis B, some of you are thinking about that why we are performing hepatitis C virus and hepatitis B virus test, because in some patient, hepatitis B virus and hepatitis C virus can cause membranous nephropathy, and SLE causes diffuse proliferative glomerulonephritis. That's why we are performing what? Hepatitis B virus, hepatitis C virus, hepatitis B virus, and SLE. For SLE, there is antigenous antibodies and anti-nuclear antibody. After that, after that, I will mention one of the important thing, that the most accurate test for nephrotic syndrome. The most accurate test for nephrotic syndrome is renal biopsy. And why we are performing the renal biopsy? Because we are performing the renal biopsy in order to differentiate between the different types of the nephrotic syndrome. In order to see the deposition of the antibodies. Before the renal biopsy, keep in mind that before the renal biopsy, we will perform what before the renal biopsy? Before renal biopsy, we will perform APTT and PTT in order to check the clotting factors. In order to check the clotting factors, we will perform the APT and PTT before the renal biopsy in order to check the clotting factors.